So this is the first of a series of podcasts highlighting staff within the School of Archaeological and Forensic Sciences at the University of Bradford. And I'm delighted to introduce Karina Croucher. Karina, why don't you tell us about yourself?
Hi, I'm Dr. Karina Croucher. I'm a senior lecturer in archaeology at the University of Bradford. I'm also the faculty director for equality, diversity and inclusion. And I've been at Bradford for maybe about 6 years now.
Before you came to Bradford, what's the trajectory that brought you into academia?
I came into archaeology through quite an unusual route. I took a year out after my A-levels to do a bit of travelling, and in that time applied to the university up in the Lake District to do teacher training. Didn't get a place, couldn't bear to go back to Croydon from the Lake District, so I just ended up getting a job in a cafe, and I worked for about 6 years in catering, and I ended up in a motorway service station on the M6 working in the granary, and just decided that I had to do something else. Went to see a careers advisor at the local library who advised me that I could give university a try and to just choose a subject I would enjoy. And in all my travels, I always kind of headed towards archaeological sites. So I decided to just give that a go. Manchester Uni accepted me as a mature student and just found a passion for the subject. Really loved it. Stayed at Manchester to do my master's and PhD. Then worked for the Higher Education Academy for 3 years for the Subject Centre for History, Classics and Archaeology. And then I did a postdoc back at University of Manchester. I moved into working in widening participation. So I was widening participation officer for humanities for a year, and then went back to do some temporary lecturing at Manchester, and then got the job at Bradford. So that's probably a much longer answer than you expected.
That's really very interesting. It makes me think about the various pathways in which people come in, and it's quite inspirational, to be honest. You must feel like it gives you something slightly different to those who come in through much more traditional ways.
Yeah, it's quite interesting. It's part of the reason that I'm such an advocate for widening participation and for giving students a chance. You know, I'll often be supportive of students that might not appear on paper to be traditionally academically driven. And I guess that's from my own experience of realising that actually having that drive can take you a long way. So, just a firm believer in how transformative higher education can be and how we should be giving people a chance, and that it shouldn't be an elitist opportunity, but that should be accessible to all.
The way in which you've come in also, I guess it must give you a different perspective on the way in which you do research. Tell me a little bit about your historic research and how that's developed.
Yeah, sure. So I started out in Near Eastern archaeology, or funerary archaeology, particularly of Southwest Asia, prehistory. So looking at examples such as the plastered skulls from the pre-pottery Neolithic in the Middle East, where someone would, bury the skull of an ancestor beneath a house floor, and then, recover it, cover it with plaster or clay, and keep that in the household. So looking at those ideas of keeping the dead close to the living, and that developed into thinking about how funerary archaeology can be relevant today. So I headed up the Continuing Bonds project, which looked at using funerary archaeology for getting people talking about death and bereavement, which can be quite difficult or quite taboo topics, and thinking about the value of archaeology for the contemporary world.
Well, so yeah, this is really it. The idea that archaeology can be used in a way that really has a role properly within society. You must have clinical applications for the research that you're doing.
Yep, sure. So in the Continuing Bonds project, we ran workshops with health and social care professionals and students across Bradford and Leicester. And we basically took archaeological case studies of funerary archaeology to the health and social care practitioners and students, and kind of watched what happened. And we looked at the way that people would very quickly move from talking about what happened in, ancient Egypt, or the plastered skulls, or people burying objects in graves, to them talking about their personal or professional experiences, the past being used as a gateway to opening up the topics of discussion. We've done various kind of outreach and public engagement behind this as well. We did some work where we had displays up and around pubs and bars in Leicester to watch what happened, and people would start talking about the archaeology and very soon start talking about their own experiences, their own hopes and expectations around death and bereavement, in a way that, you know, you would have got the barriers up if you'd gone to them on a Friday night and asked them to start talking about what they wanted for the last days of their life. But actually talking about it through archaeology really kind of opened people up to the topic in a really kind of engaging way. So it's just like really refreshing to see that archaeology can have such a valuable role to play in contemporary society and for that clinical setting.
Well, that really is fascinating research. Unfortunately, we've really got to end now. So thank you, Karina.
Cool. Thanks for chatting.